Hello, if you are watching this video, you've been diagnosed with a disc problem or suspect that you do have one. And let me tell you, you are in the exact right place for this problem. First off, let me clear up a real quick misconception. There is no such thing as degenerative disc disease. It is not a disease whatsoever. It's a compressive lesion. You put too much weight on a disc for too long of a period of time and it wears out. Let me explain how that works. Your spine is the weight-bearing structure in your body. Everything's attached to the spine. Your arms, your head, your legs. Any stresses you put into your body all go into your spine. Now, the biggest stress that we put into our spine is the stress of gravity. Gravity is pushing us down and planting us on this earth all day long. Because of this constant stress on your spine, when God designed your spine, He designed it like a spring. It is a series of opposing curves that absorb and distribute the weight of your body evenly amongst all of the discs and all of the joints. When you have an arch, whether that be on the top of a bridge or the roof of your car or in your spine, when you place a load into an arch, that load is shared and divided equally amongst the entire arch. All the discs and all the joints each take a percentage of the weight placed into that part of your spine. So in your low back, you have 5 discs, 5 sets of joints, and 5 bones that all take a percentage of the weight of your body. Now, if you do have a different trauma sometime in your life and you lose a bit of this arch and your back goes straight in some part, a straight back does not distribute and divide the weight evenly. People that lose a curve in their low back, typically always their disc problems are at either L5 or L4. A second way we can compress these discs and wear them out is by a structural kink. We call that scoliosis. Again, this can be caused from a different trauma earlier on in your life, or you could have been born with this. I'm going to exaggerate this a bit so you can see this. If we have a kink in our spine and we push down all day long with the stress of gravity, where does that stress go? Right to where the highest point of that kink is. This is where the disc will wear out, and this is where the joints will wear out because there's an exorbitant amount of stress being placed to this region of your spine. This will lead to eventually to a bulging disc or a herniated disc. Now, it doesn't lead immediately to a disc problem. It takes many, many years to degenerate and get to that point. Let me explain how that works. Your disc in your spine acts as a shock absorber and also is used to hold the bones apart so that there's a hole created where the nerve comes through that goes down your legs or down your arms. These discs are made out of very, very strong cartilage. The outer part of the discs are called annular fibers. They're circular fibers or cartilage that encapsulate and enclose a jelly-like material called your nucleus pulposus. This acts like a ball bearing inside of your disc in your spine, so each bone has something to pivot over and around. How your discs stay healthy is by blood flow, and how the blood gets in and out of your discs is by everyday normal motions. It creates a pumping action when you move, and it pumps the blood in and out of these discs. Because the blood pressure is 0 when it gets to your spine, the blood is not forced into these discs and comes out. It has to be made through motion. Very important that we have motion. When you have a compressive lesion caused by a kink or loss of a curve, like we talked about earlier, it doesn't allow this blood flow to get into your discs. And as a result, your disc will start to die and get skinnier and thinner. These circular fibers will start to all split and get weaker. And eventually it leads to the point where you bend over to pick up a pencil off the ground and something pops in your back. And what's happened is these circular fibers have all split open and this jelly-like material has a direct pathway to the outside. And it can hit you either in the spinal cord or the spinal nerve root. If the disc is hitting you in the spinal nerve root, all of your symptoms will be on one side, down one leg, down your right leg or down your right arm. If the disc is bulging and hits you in the spinal cord, your symptoms can be down either side or both at the same time. Now, our solution to fixing these bulging discs is something called spinal decompression. It's the compressionary forces of gravity that are pushing on these discs, making them bulge out and squeeze out. And we want to do the opposite and decompress and pull those discs apart. We use something called the Axiom Worldwide DRX 9000 decompression table. It is a very sophisticated piece of equipment that will literally fix these discs. And how it works. First, let me use an analogy. Have you ever put too much toothpaste on your toothbrush? And to save that 1/10 of 1 cent, you take your toothpaste tube and pull it apart and suck that toothpaste back inside of itself? Same thing is happening when we use this decompression table. The decompression table very gently takes your discs and pulls them apart like an accordion. If you pull an accordion apart, it creates a negative vacuum pressure within that accordion, and air is drawn inside of that accordion. If you take a disc and pull a disc apart, it creates a negative vacuum pressure within that disc and sucks in the bulging disc material that had been extruding outside of that disc and sucks it back in place where it's supposed to be. This treatment is a fantastic treatment that just flat out works. We couple that treatment with something called a medical laser. What the medical laser does, it causes cells to heal 3 times faster than normal. You see, you're going to have some splits in that disc that allowed that channel way where that disc material started to creep out of, and we have to heal those cracks in that disc, and we use a medical laser for that. The tables that we use in our office are called DRX 9000s. They are the Cadillac of decompression tables, and they just flat out work. This table in this room treats both people with herniated discs in their neck as well as herniated discs in their low back. If you have herniated discs in your neck or bulging discs in your neck, we hook you up to the head harness here. We put you in this cradle, and the table will very gently decompress your neck. Or we can hook you up down at this end of the table by your low back and decompress your low back. So how this table works, as it is gently pulling your spine apart and taking those compressionary forces out of your spine, it's measuring the muscle activity, what your muscles are doing, because your muscles are going to want to go into spasm and prevent that from happening. As this table is gently decompressing your spine, it's measuring your muscle activity, and every time your muscles turn off, the table lets up a bit and turns them back off. Then the table will gently start to pull. If your muscles turn on, it lets up a bit, turns those muscles back off. This table will do this monitoring and correction over 1,000 times per second. So as a direct result, within 15 to 30 seconds, we can have your muscles completely turned off and relaxed and truly decompress your spine. Take the pressure within those discs from a positive 180 millimeters of outward pushing pressure to a negative 180 millimeters of inward sucking pressure so that we can actually achieve decompression. This is completely different than a spinal inversion table, let's say, where you hang upside down. You see, because of those muscles, when they go into spasm, they don't allow decompression to happen. You have to take those discs to a negative vacuum pressure in order to draw back in that bulging or herniated disc. If you're tired of living in pain, not being able to do things in life anymore, and are ready to reclaim your life, you are in absolutely the right spot. One of our doctors will be with you shortly to answer any questions you have, to look at your MRIs and X-rays on our computer, and to see if you're a candidate for what we can help you with. If you're serious about getting well, we're serious about getting you well. Thank you very much for coming today, and we look forward to getting you better.